First, I'm going to assess my patient's record. Hi, my name is Mariah. I'll be your nurse today. We have physician's orders to do a physical assessment on you, so can I get last name and birthday?
Aikins 12497.
Perfect. I'm just going to wash my hands and provide some privacy. Then I'll assess for a patent airway, so I'll have you open your mouth and I'll just take a look in there. Good. Do you have any difficulties breathing at all? Any shortness of breath? Do you use any oxygen at home? No. Okay. Have you ever had surgeries, traumas that would affect your airway? Any respiratory diseases? No? Okay. Then I'm going to go ahead and stick this on your finger, and I will count your respirations while we do this. Alright, oxygen is 97% and 18 respirations per minute. Okay, now I'll have you slip your shirt up in the back and I'll take a quick listen to your lung sounds, and every time you feel my stethoscope touch, if you could just take a deep breath for me. Good, and you can put your shirt down back there, and I'll have you lift up your shirt up in the front. Okay, and same thing, take a deep breath for me. And one more time. Good. Alright, now I'm going to listen for bruits in your carotid arteries, so if you could tilt your head to the side for me. Good, and the other side. Good, now I'll have you lift up your shirt again in the front. We're going to take a listen to your heart sounds. So first I will listen at the aortic valve, which is the right second intercostal space. Good, and the pulmonic valve, which is the left second intercostal space. And Erb's point, which is the left third intercostal space. And the tricuspid valve, which is the left lower fourth intercostal space. And the mitral valve, which is the left fifth intercostal space, medial to the midclavicular line. And then I will take the apical pulse at this location for a full minute. Apical pulse is 82 beats per minute. Now I'll take your radial pulse, so I'll just feel your wrist here. And radial pulse is 82 beats per minute. I'll take a blood pressure with the appropriate size cuff. So I'll put this on your arm here. And I will hold your arm at heart level so I can hold that. Good, 124/78. Excuse me. And I will go ahead and assess your fingers. I'm going to give your thumbs a pinch. Assess capillary refill. Good, capillary refill is less than 3, and I'll do the same thing on your toes. Capillary refill less than 3. Alright, and I'll take another look. I don't notice any clubbing on the fingernails, on the toenails, and I don't notice any swelling or edema on the upper extremities or on the lower extremities. Good. Now I will give the back of your hand a little pinch. Good, turgor is less than 3. I'll feel your neck here. I don't notice any jugular venous distension. I'll feel for lymph nodes. No swollen or enlarged lymph nodes noted. And I'll feel your carotid arteries one at a time. Good, then I'll feel all your peripheral pulses starting with temporal, brachial, radial. I would feel femoral. And I'll have you roll your pants up past your knees for me. I'll feel popliteal. I have you scooch further. Perfect. Popliteal is behind the knee. Good. And I will feel posterior tibialis pulses, right behind the ankles, or on the inside of the ankles. Good. And dorsalis pedis pulses. Good. So now some questions here, just to assess level of consciousness. Can you tell me your name?
Dave.
Good. And do you know where we're at today?
Yep.
Where are we?
69th in Minnesota.
Good. And can you tell me the date?
January 26th.
Good. Now I'm gonna I'm gonna say 3 words and I'll have you remember those for later. Banana, sunrise, chair. Got them?
Yep.
Okay. Now we're gonna test your cranial nerves. So I'll have you close your eyes for me. And I'm gonna have you smell something if you can tell me what it is, please. Or what it smells like.
Clean wipe.
Okay, an alcohol swab. Then I will have you can roll your pant legs down and we'll go out in the hallway and we'll test your vision once. Excuse me. So I'll have you come all the way down here. And you can stand even with this door frame there. And now, can you tell me what is the lowest line that you can read?
10.
Go ahead and read it for me.
Is it F, D,
That's okay. Let's try this one.
Nine.
Yep.
LEFODFCT.
Good. And if you cover one eye, can you read that same line?
LEFODFCT.
And if you cover the other eye, can you read that line backwards?
TCFDOFEL.
All right. 2015 vision bilaterally. I'll have you come this way, and you can have a seat back in the table there. Okay, I'm just gonna wash my hands. So cranial nerve 2 is intact. I will have you follow the tip of my finger for cranial nerves 3, 4, and 6. So just follow it with your eyes, please. 6-point gaze is intact. And now for cranial nerve 5, I'll have you close your eyes again for me. And I'm just gonna touch your face with a cotton ball, and I want you to tell me where it's at.
Ooh, left side below my eye. Nose. Chin.
Perfect. Cranial nerve 5 is intact. For cranial nerve 7, I'll have you smile for me. Good. And cranial nerve 8, I'm just going to stand over here and whisper some words. And if you can repeat them.
ABC.
Now over here.
DEF.
Good. For cranial nerves 9 and 10, can you say ah? And cranial nerve 11, can you shrug your shoulders? And cranial nerve 12, can you stick out your tongue? Perfect. And when you smiled earlier, I noticed that your face was symmetrical. I'm going to test your pupils here, so I'll have you look straight ahead at me. I'm just going to shine the light. Pupils are equal, round, and reactive to light, and can you follow this to your nose? And they accommodate. No drainage or redness noted. Alright, and can you remember those 3 words that I said earlier?
Banana sunrise chair.
Good. Alright, now I'll have you stand up for me, and we're going to do what's called the Romberg's test. So if you could stand up. And I'll have you stand just like this, and close your eyes. Good, the patient is not swaying, so negative Romberg's test, and you can have a seat again. Alright, and we'll test the strength in your extremities, so if you push down on my hands, and push up, and squeeze my fingers. Good. Can you push up on my hands, and push down? Good. Alright, so now we'll have you, we're going to test range of motion, so if you can do this, this, and this. Good, and hands, and fingers. Good, then for legs, when I'll have you stand up and I'll have you go like this, and then like this.
Stand up.
Yep. Oh, sorry. I'll have you put it right over there.
Do what?
Just like that, and then up. And can you, ankles and toes. Good. And now you can have a seat again. And I'll have you roll your pant legs back up for me, and we'll test your reflexes and your patellar reflex. We'll try that again. Alright, and the other one. Alright, and brachial reflexes. So just relax your arm for me. One more time. Okay, and this one. Good. And earlier when you had a shirt up, I was assessing his skin. I don't notice any bruises. And when his pant legs were up, I didn't notice any bruises. I do notice one cut on his right thumb. Otherwise, skin looks to be intact. Skin is warm, dry, and intact. Alright, we'll go back in the hallway and we're going to take a temperature, height, and weight. So if you'll follow me. So we'll wait for that to turn on just a second. Alright, you can hop up there. 190.2. Alright, now can you take your temperature? 98.4. And we will come take a height right over here. And I'll have you back all the way up with your feet against the wall. 70 inches. Alright, so you can have a seat again. Are you having any pain today?
Not physically. I'm kidding, no.
Okay. I would position my patient for comfort, give them their call light, make sure they're comfortable. Are you having any symptoms that brought you in today?
No.
Any allergies that you know of?
Hmm.
Do you take any medications regularly? No? Any medical or surgical history we should know about, like any surgeries that you've had? No? When was the last time you had anything to eat or drink?
Last night.
Okay. Like before bed?
Yeah.
Okay. And any events that brought you here today?
No.
No. And if it was a physical, that makes sense. I assessed that he has good hygiene. He's well groomed, appropriately dressed for the weather. I'll take a quick look at your scalp here. Scalp is not dry. Alright, and I noted already that the temperature of the skin was warm, it was dry, and it was intact. We'll take a quick look at your ears, your nose, and your mouth. Alright, so first I'll have you open your mouth for me and lift up your tongue. Mucous membranes are pink and moist. Take a look in your nose. Mucous membranes are pink and moist, no drainage noted. Take a look in your ears here. And tympanic membrane is intact, no drainage or redness noted. And tympanic membrane is intact, no drainage or redness noted. Alright, and I'll have you lay down for me and lift up your shirt just a bit. I'm going to take a listen to your stomach. So if you can lift up your shirts. And, okay, and it is, I don't notice any hernia, no abnormalities. So I'll take a quick listen and I'll start in the right lower quadrant. Good. And I will push here. Tell me if you have any pain with that. Good. And you can sit up. And do you have any problems passing gas at all?
No.
And when was your last bowel movement?
I don't know. Yesterday?
Yesterday? Okay. And any changes in stool at all?
No.
Any problems going to the bathroom, like urinating? Any pain with that? Any reproductive issues, like any lumps, bumps, or discharge? No? Okay, then I would go position my patient for comfort, and I would go document the general appearance, level of consciousness, all the vital signs that I took, any abnormalities noted, and how my patient tolerated the procedure.